Hi, this is Melissa Tchaikovsky, and I am doing a video presentation for my nursing informatics class on ethical and legal considerations in nursing informatics. This topic is very broad, and there's many things that fall under these categories, so I wanted to try to focus on something smaller, and I wanted to look at some roles and some organizations that help with the ethical and legal considerations in this topic. So the first thing that I want to do is I want to talk about a chief privacy officer. When I was thinking about the legal and ethical considerations in this, I went back to my hospital days and the people that were in those roles. And I have to say, I kind of forgot about the chief privacy officer. So this role, when I went in and started looking at my information, actually began back in the 1990s. They are responsible for a lot. They are responsible for developing and implementing policies to protect patients' privacy. They oversee ensuring compliance with all the privacy laws, all things privacy completely, including like data collection, storage, usage of EMRs. Their responsibilities, as I said earlier, is they have to monitor the compliance. They oversee all this. They see whatever systems the hospital has that pulls things to make sure that people aren't in medical records that they don't need to be. They do a lot of investigation of accidents where people have accessed the wrong medical record. It's their job to stay up to date on all information and keep all of the nurses and the providers and anybody that's accessing medical records, keep them up to date on all the education. Then we need to think of disaster planning. This is big things that we hear a lot about regarding data breaches and cyber attacks. Then I wanted to touch base on a little bit of the ethical and legal issues that affect the health informatics. So they have the protection of all PHI. They have system implementation when they are putting new EMR systems into work. Researching the ethics of all of this, the liability of the entire health system, and the dilemmas that they face when they think about interoperability. So providers, no matter what system they're at, can easily pull up a cardiac cath imaging, can easily pull up that MRI. If somebody is in, a little local hospital and has to be life flighted out, it's so important to have interoperability amongst our systems. And another thing I realized is this kind of all starts with the Privacy Act of 1974. So the Privacy Act of 1974 is where the U.S. federal law that works to protect the privacy of our U.S. citizens by overseeing how the government assures personal information. This act also put into effect the consents prior to release of records. This is really where it all started. So then there's a few organizations that I honestly didn't even know existed that I thought was interesting to add to this. And there is an organization that's the Confidentiality of Alcohol and Drug Abuse, Patient Records and Regulations. This is in regards to protecting patients in substance abuse treatment programs. Then there is the IRB, which is the Institutional Review Board. This was established by government health sciences to protect people that participate in human research. This was another fun fact that I didn't even know existed. And then if we're talking about this, we need to talk about HIPAA. So HIPAA stands for the Health Insurance Portability and Accountability Act, that was made to protect the privacy of patients with all medical information. HIPAA made a big change in healthcare. Then there's the Code of Ethic and Standards. HIM staff have an obligation to keep patient privacy and secure their health informatics. It also involves assuring accessibility and the integrity of the health information system. So health information management needs to consider patient safety first at all times. And team members in HIM must be trained on policies and procedures. Passwords and logins are never to be shared, and health system needs to have a policy where they are changed frequently. This is always ever changing and requires constant education, updating and evolving and sharing with our teams to keep the healthcare system the best that it absolutely can be. Then the last thing that I wanted to talk on was just some ethical controversies. So think about this technology world that we have, and everybody with hackers and ransom and all of these things. We live in a world where our EMR needs to be as confidential and private as possible. Then I was thinking, look at all the people that access one EMR. You have the people that you meet when you come to check in. You have the coders that work with the physicians to make sure all the diagnoses were captured. You have the radiology staff and the laboratory staff and your nurses and your CMAs and your providers. There are so many people that touch an EMR that we need that constant surveillance to make sure that patients aren't doing something wrong, that they're not patients, that the workers aren't doing something wrong. I know in a healthcare facility I worked at, there were multiple check-in staff that were fired because it has been found out that there were patients that they were accessing and actually looking through patients' charts. They weren't just going in and updating the insurance and the address and making sure they signed their release of information. They were actually going in and digging into records. So that's one thing that I can relate to personally. Another thing to consider ethical concerns when you think about this is the clinical documentation. Copying and pasting, copying and forwarding. This was another issue that I had in the same workplace where nurses were taking notes and copy and forwarding, and they were obviously trying to cut corners. But in that, they didn't go back and make sure that they made sure the information, and it was documented visit after visit or assessment after assessment, that they had obtained this BMP, which was actually only on the first one, but it kept being copied and forwarded over. So we really need to consider the risk of having such high-tech clinical documentation can really open us up to a lot of errors when we are trying to cut corners. And the last thing I want to talk about, which is where I struggled with, were computers in the exam room. When a nurse comes willing in their computer or a provider comes in willing their computer, does the patient really feel like they are important and that they are the center of that visit, or do they feel like that computer is the center of the visit? It can become very distracting, and it can also lead to barriers in patient care. So with that, I had 3 references that I wanted to make sure captured on our video, and I have my first 2 references and my website, and then I have my last one. And I just want to make sure, the first one was ethical controversies about proper health informatic practices. The second one was legal and ethical issues in health informatics. And the third one I really liked, and I'm citing as 7 reasons why every company should appoint chief privacy officers. So once again, I just want to share my references. And I hope you enjoyed my presentation. Thank you.